Welcome to the Preventive Medicine Podcast. Help us change the paradigm of medicine from keep people alive to help people thrive, one episode at a time. And now, here's the show.
Yeah, I mean, definitely it's like those things that it's like almost like inherent of like things we all hear all the time. And it's like, they actually make a difference when we start to actually do them, kind of in terms of low back pain and clinicians, when someone comes in, do you feel that there's a big discrepancy right now between what the evidence would suggest about how we talk to people about back pain versus what happens in real life when someone comes in and, maybe they do get the imaging or they get the MRI and, the surgeons talk to them, well, you have the joints of a 90-year-old, you have the discs of a 9-year-old. So can you kind of talk us about the nocebo kind of issues with talking to patients and narrative about back pain?
Yeah, I think that's a major component of what we can do as clinicians better. Obviously, like the previous conversation was about what the individual themselves can do. And a lot of that will benefit them from a standpoint of improving their health and also showing them the structural strength of their spine that they can handle different tasks. Because a lot of times when you go to meet a clinician across pretty much any field, they will likely tell you some sort of negative aspect about your body. It's a very unfortunate point, but usually that's the thing that gets blamed and pointed to for why someone is having pain. You can go to someone that is you go and see a physical therapist, you go see a physician, you go see a surgeon, you go see a chiropractor, or pretty much anyone in general. And you will likely be told that you have back pain because you slipped a disc, or that you have something wrong with you, or that you have the spine of a 90-year-old. It's a very common narrative. And when we start to actually look into where people find meanings, because as we discussed previously, pain doesn't necessarily match up with the structural aspect of someone's spine or the body in general. But a lot of times what we actually see is that the meaning that someone has around their body matches up more distinctly with either the person's pain or the way that the person manages their pain. And the meaning that people get about their body will heavily come from the experiences that they have with different types of healthcare professionals. And, the point of this podcast is preventative medicine. And one of the easiest things that we could do as clinicians is watch the things that we say, and it will have a huge reduction on someone's risk of long-term disability. There's some great research from a few different people, but one particularly is Ben Darlow down in New Zealand. And he's the one that's pretty much known for anything related to semantics and back pain. And he's highlighted numerous times that the words that clinicians say have a long-standing impact on people. They'll go in and have people meet with a physician. He actually works in the field of medicine, so it's not necessarily as applicable to physical therapy, I guess, but I would argue otherwise. And but he goes in, he has people go and meet with physicians, and then after they speak with the physicians, he asks them to describe what they got from the meeting. And usually it's these stories about, well, my spine is very fragile, my pain is from this thing, and that it won't be better until surgery happens, or it won't be better until X happens. And, when we look at a lot of these different types of treatments that we can do for back pain, we do see relatively consistently that, it will go away in time. In most cases, you don't have to necessarily do anything. In other cases, you can do physical therapy and other types of conservative care, and it will get better. The vast majority of back pain will improve with time and some sort of treatment. However, a lot of these people don't believe that because they're told that it won't get better until something changes. And when you actually compare the likelihood of someone seeing results from care, that heavily impacts it. The people that don't believe that they can get better until they have surgery will likely not get better until they have surgery. And again, that returns back to what is the story that we're telling as clinicians? If someone comes in and has back pain and I explain that their spine is fractured, or they have a disc herniation, or that they have anything inherently wrong with them, it's going to set them up to where they will believe that they can't get better until that's fixed. And how would physical therapy fix that? How would exercise fix that? How would any of these things do that? Like, it doesn't make sense. My spine is fractured. It won't get better from exercise. And in a lot of cases, they might perceive that it would actually be more negative for them to do that. That's when that in the shoulder, we have research on that, when people are told that they have shoulder impingement, they often want to avoid exercise because they believe that it will make their shoulder worse. And we can see that in those people that they will then avoid exercise and get consistently worse across time. And we have similar research also on back pain, where if someone is injured, sees a physician or some other healthcare provider that gives them some sort of belief like this, they usually have a further worsening of their actual health factors. And they're set up to have more chronic disability from it. In contrast, when someone is actually given the opposite story, when they're explained to how their back is strong, robust, and resilient, we now, in the last couple of years, have been seeing research emerge that when we can explain that to patients, it actually doesn't necessarily change how fast their back gets better, but it does increase how much function they have while having back pain, and it reduces their likelihood of returning back for further care. So that's like a huge impact when we start to consider in the US system, the amount of money spent on seeing people is just outrageous. And so if you can just have the simple thing of saying, like, no, your back is okay, you'll be fine. You're gonna have to give it some time. You could go do some physical therapy, do some exercise, whatever we so choose about that, but you'll be good. Your back is strong and it's killing it. And giving something like that and they don't end up having to come back and see you is huge.
Yeah. I want to just emphasize when you were talking, or just add a side note, kind of when you're talking about the American system with the amount of money that we spend on that. I'm reading An American Sickness right now, which talks about kind of how broken our system is at kind of every level. And with the frequency of people who come in with back pain and how diagnostic rabbit hole you get imaging, blah, 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 it just keeps going on. There's a lot of expenditure there. So that's just been opening my eyes reading that book. But I just want to reiterate, because it's so important what you said, and I think provides a lot of value to whoever's listening to this, because we have some clinicians listening to this podcast. We might have some patients listening to this podcast. So I want to reiterate that how you perceive your pain, in a sense, or your own resiliency from both like how a clinician would speak to their patient. So you have to be careful of how you're speaking to your patient and what words you're using in that communication. And then for the patient side of viewing yourself as being able to be resilient and strong and being able to recover from whatever it is and not seeking surgery, not needing surgery to quote unquote better. So I think that was incredibly important to reiterate, just because it provides a lot of value, and also in the US prevents a lot of economic burden as well.
And then one thing I just kind of wanted to touch on is to get your thoughts on. So in terms of we're talking about preventive medicine in this podcast, do you think that having someone in their mind, if, say they're an athlete or whatever, or just a regular person, just the knowledge that if they have a back tweak and they wake up or something hurts or whatever, to not automatically jump off that cliff, so to speak, of oh no, something is wrong with my back, versus a mindset of this is going to be annoying, but the natural history of this is going to go away. I can continue to do all my daily activities. So do you think that internal narrative or maybe the knowledge of knowing hey, the back is very strong, resilient, and even for people who don't train or don't do anything, the natural history of back pain is that it goes away. Do you think having that knowledge just already would prevent a large number of trips to the doctor?
Yeah, absolutely. And that's actually one of the key things that I try to express to any of my patients. And my friends and family, anyone that has back pain that wants to talk about it, that's one of the first things I discuss with them. And, my neighbor just had some back pain recently. She was picking up her kid out of the crib and she was like, oh my gosh, I think I broke my back. And I just gave her that simple point of that it'll be okay. Give some time, natural history will occur. You'll be just wait and see. Don't worry about going to see anyone yet. Just continue to do your things and just watch what happens. And it's been about 5 days now. And I just saw her outside before we came on the podcast, and she was waving, she's walking around, no issues. And I think, like you said, a big detail there is that when you have the uncertainty and the fear, it can be extremely debilitating. And once you have the knowledge that to challenge that idea, it can hugely change your perspective on it and how you then go forth and manage it.
Preventive medicine is an incredibly important topic. I want to thank you for taking the time to watch this video. For the full episode, find us on your favorite podcast streaming platform. If you enjoyed this video, don't hesitate to hit that subscribe button, like this video, and share it to keep that message spreading. Thank you once again for watching this video, and we'll see you in the next one.